Thank you, Dr. Rao Ivatury, for talking to us today about the Pan-American Trauma Society and the available fellowships. And there's a fellowship and an observership. Can you tell us a little bit about the society, for starters?
Okay, the Panamerican Trauma Society is an organization that was brought together by North American and Latin American surgeons together about 25 years ago with the mission of improving trauma care in both Americas. And so this society involves a membership of a lot of nationalities, and we have an annual congress which meets every November in different parts of North and South America and exchange ideas and exchange techniques of treating trauma patients. And once again, the idea is to improve trauma care in both of these countries.
So do you think that there are lessons to learn from the various countries and their different populations and the different ways that they manage trauma?
Yes, there is a lot of lessons to be learned. North Americans can learn from the extensive operative experience of the South Americans. The South Americans can learn from the extensive research activities that North America has in treating good patients. So there is a tremendous potential for learning for all people, all members.
Okay. Yeah, and the Bogota bag, that originated in Bogota, Colombia, right?
Exactly, yes.
So tell us a bit about the fellowship that the society offers.
So we have embarked on improving experience of members and young surgeons and fellows in training of both North America and South America. So for the South Americans, we offer the international observership, which involves coming to a North American center, such as in Richmond or such as in Pittsburgh, San Diego, etc., where there are level 1 trauma centers. They can learn from these trauma centers in terms of trauma systems organization, trauma registries, all the performance improvement activities that are very important for the trauma centers. And they can take these lessons back to their own countries and start these activities, which are very important for proper functioning of a trauma center.
Right.
And for the young North American surgeons in training or young North American surgeons who just finished training, since in North America the operative experience for the trauma surgeons is becoming less and less as we do more and more of non-operative management of injuries, these surgeons may not have a variety of technical abilities that the South Americans have with their extensive experience in trauma.
Right.
So they can go and spend some time learning these techniques in South America, in centers such as in Colombia or Brazil, and learn from these surgeons firsthand how to control these injuries in the patients. So this is a valuable experience. The Pan American Trauma Society welcomes applicants to apply for this, and they will match their interests with different centers in South America and arrange for their fellowship there.
Great.
And through the generosity of surgeons like Dr. Paula Ferrara, actually, who has donated some money for these things to be possible. So we are constantly looking for other benefactors and other sponsors.
Wow, that's great. So I think that sounds like a great opportunity for participants on both sides. Look forward to hearing more about this. And when is the conference? It occurs every year in October, you said?
November.
In November.
And this year is in Panama from November 11 through 14.
Okay, well, we hope to hear maybe from some of the participants there in the upcoming conference. And thank you, Dr. Ivatury, for talking to us today.
Thank you very much for having me.
I'll include a link to the information for how people can learn more about the fellowships.
Okay.
Take care.
Great.
Bye.
Thank you.
Thanks for checking out the Op Report. Help us keep conversations alive on topics in general surgery. Check out more episodes of the Op Report and other OnSurge content here at YouTube. Find us at Facebook. Follow us on Twitter. And find our homepage at onsurge.com. Join the conversation and tell us what topics you'd like to hear about and what people you'd like to hear from.